If you have an aging parent, there are certain changes you should never brush off as just getting older. As someone who has seen small signs, quiet signs, that meant much more than anyone understood at the time. Aging is natural, but some signs signal decline that needs medical attention, or at the very least, closer observation. Let's walk through 7 of them. 1. Sudden withdrawal or personality changes. One of the earliest red flags I often see is emotional withdrawal. If your parent was once talkative and social but suddenly becomes quiet, detached or uninterested in things they used to love, pay attention. I've had families say, they just seemed tired. They didn't want visitors anymore. We thought they were just aging, but sudden withdrawal can signal depression, early dementia, medication reactions, infection, or even the body beginning to conserve energy. When someone starts pulling away from life, there is usually a reason. It deserves a conversation, and often a medical evaluation. 2. Noticeable changes in eating or drinking. Appetite changes are common with aging, but drastic changes are not something to ignore. If your parent stops finishing meals, says food tastes different, forgets to eat, starts losing weight unexpectedly, this can indicate underlying illness, digestive disorders, cancer, cognitive decline, or even difficulty swallowing. In hospice care, decreased appetite is one of the most significant markers of physical decline. The body begins to slow, but outside of hospice, this sign often gets dismissed. Monitor weight. Notice patterns. Don't assume it's normal aging. 3. Frequent falls or unsteady walking. Falls are not just accidents. They are often warning signs. When balance starts to change, it may signal neurological conditions, medication side effects, muscle weakness, blood pressure instability, inner ear issues. I've cared for many patients whose serious decline began with just one fall. After a fall, independence can drop quickly. Confidence decreases, mobility decreases, health can spiral. If your parent is suddenly using walls or furniture to steady themselves, that's your cue to act. 4. Increased confusion or memory gaps. Forgetting where you placed your keys happens at any age, but getting lost in familiar places, forgetting close family members, struggling to follow basic conversations, that is different. Sudden confusion can signal urinary tract infections, dehydration, electrolyte imbalances, stroke, medication toxicity, early dementia. In older adults, infections don't always show up with fever. They show up as confusion. I cannot tell you how many times a family thought, "Mom's dementia is getting worse," when it was actually a treatable infection. If confusion appears suddenly, seek medical evaluation immediately. 5. Changes in sleep patterns. Sleep tells us so much about the body. If your parent sleeps significantly more, has difficulty staying awake, is awake all night and disoriented, has vivid hallucinations, these are not small changes. Excessive sleeping can indicate heart issues, organ decline, depression, medication effects, or the body conserving energy. Near end of life, increased sleep is one of the earliest physical signs I see. It doesn't mean death is immediate, but it means the body is shifting. 6. Poor hygiene or neglected self-care. When someone who once cared deeply about appearance stops bathing, brushing teeth, or changing clothes, something is wrong. It may be depression, cognitive impairment, physical weakness, loss of motivation, early signs of advanced illness. This sign is often subtle. Families sometimes assume they're just tired, but neglecting hygiene can signal a deeper inability to manage daily living. It's one of the biggest indicators that independent living may no longer be safe. 7. Shortness of breath or subtle breathing changes. Breathing changes are always serious. If your parent gets winded easily, breathes faster at rest, has a persistent cough, sleeps propped up due to breathing discomfort, this could indicate heart failure, lung disease, fluid buildup, anemia, or progressing chronic illness. In hospice, changes in breathing are one of the clearest signs the body is under stress. Even subtle breathlessness should be evaluated. Breathing is not something to wait and see. The most important thing I want you to hear: not every change means something catastrophic, but patterns matter, frequency matters, Sudden shifts matter. As a hospice nurse, I often meet families at the very end who say, "We wish we had known sooner. We didn't realize these were signs." Your instinct as a son or daughter is powerful. If something feels different, it probably is. Trust that. Ask questions. Schedule checkups. Document changes. Advocate gently but firmly. And most importantly, have conversations early. Talk about wishes for medical care, advanced directives, quality of life, goals of care. These discussions are not about giving up. They are about protecting dignity. Aging is not an emergency, but decline can accelerate quickly. The goal is not fear. The goal is awareness. Because when you recognize the signs early, you can intervene. You can treat. You can prepare. You can support. And sometimes, you can prevent crisis altogether. If you are walking this journey right now with an aging parent, I want you to know something. You are not alone. This season is emotional. It can be overwhelming. It can be filled with uncertainty. But being informed is one of the most loving things you can do. Watch closely, act early, love deeply, and never ignore what your heart is quietly telling you.